education. We took a different position to what the COAG agreement actually provided for by saying we wanted local clinicians on our governing councils. We've set up our clinical councils, so I think that we are well advanced in providing the mechanisms for greater clinician engagement.
We upped the ante as far as some of these boards are concerned. I believe that they need to have a real role in managing the system and in understanding all of the obligations that come with that, including financial, including communication with the communities they represent and so on.
I do think that workforce and the way we deliver training is still a big issue for us, and we've got a lot more work to do to get that working more effectively. SETI will help, I have no doubt about that, but it's a big task and one that we need to really focus our efforts on, because I think if we can get that right, that will make a huge difference for everyone who's working in the health system.
It'll be a disaster if we wake up years down and find that we could have had an opportunity to address this now and we failed to do so. I think we've got to look at this long term.
One of the things that has come back very clearly to me in the time that I've been health minister is that people feel when they're in the public hospital system that the staff do a fabulous job, but they're very, very busy and they're very they run off their feet, and so we have to find ways to address that, because that does then impact on staff morale.
I do think it's morally wrong to accept money for full fee-paying international students and then not provide the capacity for them to actually finish their internship and go back to their countries as fully fledged doctors.
I sometimes think that when we talk about health and how we deliver health services, efficiency gets a really bad name. It's almost like a dirty word. And yet we do know that a safer health system is a more efficient one. And so we have to continually find ways to work better and smarter and to make our health system safer.
I think that we've got the capacity to do much better with what we've got. I do think we need to keep increasing the budget. I'm sorry, I'm not going to be, I let my treasurer off the hook that easily, because we have increasing costs of salaries, goods and services. But yes, we can do much better with what we've got.
That we've grown the health budget by 192% since we came into government. The health budget in New South Wales is now about a third of our state budget, and our our research indicates that if we continue to grow the health budget at the same rate, by the middle of the century, it will consume the entire state budget.
I can't force doctors, nurses or anyone else to go and practice, to live and practice in the country. But one of the things I can do is provide the money to upgrade the facility so they've got a decent place to work. And